President, you're a proud father. Would you have vaccinated your children differently based on the recommendations?
Well, I did. I took my children for 5 different vaccinations. In other words, I broke it up. The one visit where they just pump, what seemingly looks like gallons, where they pump so much in. I took all of my children from day one. I believed in this a long time ago. I took them with my wife. I took them through 5 different visits to the doctor. Essentially, they get 20% each, and I had no problem. So it's inconvenient. It's 5 stops, but it's something that I think will have a huge impact on autism.
President Trump yesterday signed an executive order aimed at revamping childhood vaccine recommendations. Most of what he said there, wrong. The order advocates separating the MMR vaccine for measles, mumps, and rubella into 3 different single shots, despite no credible evidence that separating them provides a safety advantage. Trump also repeatedly suggested that the number or timing of vaccines could play a role in rising rates of autism, despite scientific consensus and decades of studies that have firmly concluded there is no link. For more, let's bring in MS Now senior medical analyst Dr. Vin Gupta. Dr. Gupta, so good to see you as always, but especially on this, an important story. We need to do some fact checking. Let's start there with the autism piece of this. Can you just underscore to the audience the lack of evidence that suggests there's any connection here?
Sure, Jonathan. This has been looked at now, as you pointed out in the 6 a.m. hour, for decades. And it specifically looked at whether or not MMR, all these vaccines that we've been giving kids now for decades, has been linked over time to the development or the increased incidence of autism. And it's looked at multiple different factors, not just vaccines. And these studies have proven that there is no link between giving any series of vaccines for say, from birth to 2 years of age and the incidence later in life of autism. So that's been proven serially. There has been one study in 1998 that, again, you pointed out in the 6 a.m. hour, that looked at 12 children that was equivocal. That was a poor study that perhaps suggested a signal that needed to be looked at for the MMR vaccine and autism links. That has been disproven several times, so there is no link.
So setting aside the autism piece of this, separating these 3, the vaccine, which are combined currently, MMR, into 3, are there any benefits to that? Is there anything in terms of the efficiency of the vaccines or other sort of side effects that they could be taking into account?
No, and so there has been no proven need to separate MMRV or MMR, measles, mumps, and rubella into 3 separate shots. No evidence that there's a safety signal, no beneficial impacts for children. What I think we should say for our audience here is that when there has been deemed a safety signal, so there's a vaccine called MMRV, measles, mumps, rubella, varicella. Jonathan, for those that get that, the first shot of that between 12 months and 47 months of age, there has been an increased incidence of febrile seizures. Very low risk, but there is still a signal. So what have we done in the medical society establishment is we've said, hey, we need to separate and separate those vaccines because we see a potential safety signal here. So that's exactly what we did. So when there's been a need to separate vaccines for kids, we do just that, but we don't do it for MMR.
That's important context. So just give us the big picture take here. I mean, this are significant changes to the childhood vaccine schedule, frankly, being pushed by conspiracy theorists.
Well, what's the knock-on effects? Number one, what are we going to see with hepatitis B? They spent a lot of time talking about hepatitis B, comparing us to Denmark. First of all, the reason that we do the things that we do here in the United States is based on what we see at the population health level. Hepatitis B here is a risk that is posed to the United States population that is different fundamentally from the population of Denmark. They want to move us towards a risk-based protocol, which is to say, let's test every mom and then give their babies the vaccine for hepatitis B if that mom tests positive. We've tried that, Jonathan. 20,000 babies on average estimated to have hepatitis B with that approach prior to 1991. We've moved to universal hepatitis B because that was deemed unacceptable. So we've already seen the impacts of these policies because we've done them before. We've learned and we've adapted and tried something different that has been very effective, this universal shot for babies for hepatitis B, to root out that disease. And so we're going to see what are the knock-on effects, increased disease burden. We're already seeing this they're talking about MMR How many times have you and I had this conversation about measles? We're in
Yes.
the worst measles epidemic we've seen in at least 35 years. And here they are introducing confusion into the public sphere yet again on that specific vaccine. So what is this going to do? It's going to worsen it. It's going to create greater confusion. And we have competing guidance on childhood vaccines from the federal government versus, say, the American Academy of Pediatrics. We have states doing something different from the federal government. This can impact school-based recommendations, what we do at the state level, and ultimately, frankly, what insurances may or may not cover. So there are significant consequences to what they're doing.
Very well said. I mean, the nation is less healthy today than we were the day that President Trump was inaugurated. We have to leave it there, but come back soon to continue this important conversation. MS Now, Senior Medical Analyst, Dr. Vin Gupta. Dr. Gupta, thank you as always.